All right, so today we're diving into something that most people kind of try to avoid talking about, right?
Yep.
Bad breath.
Yeah.
Not just, the occasional kind of, oh, I had a tuna sandwich for lunch kind of thing. Like, seriously, bad breath. Chronic halitosis.
Right, right.
We're going deep using this ebook, Bad Breath,
Hmm.
a comprehensive guide to understanding and overcoming chronic halitosis.
Sounds comprehensive.
Yeah, it is. It's really interesting stuff, actually, and I think it'll help a lot of people because, if you have that kind of chronic bad breath, I mean, that can really affect your life, can't it?
Oh, absolutely. Relationships, jobs, confidence, the whole nine yards.
Yeah.
Yeah.
So let's just start by defining, what's the difference between just regular bad breath and the chronic kind?
Okay. Well, I think the key is really in the word chronic. I
Right.
mean, it's that persistent. It doesn't go away, even if you're, brushing and flossing and doing all the right things.
Right. Okay, so then what are some of the most common things that people maybe don't realize cause bad breath?
Well, I think a lot of people just assume it's all about oral hygiene.
Hmm.
And while that's, obviously a big part of it, it's not the whole picture. I mean, obviously, if you forget to brush your teeth,
Yeah.
that's going to do it. But, things like gingivitis, which is inflammation of the
Huh.
gums, and even periodontitis, which is, that's a more serious infection that affects the tissues that support the teeth. Those things can all contribute to chronic bad breath.
Oh, so it's not just about like the food that's stuck in your teeth, but the actual health of your gums.
Exactly.
Yeah, okay. Interesting. But, sometimes it's not even originating in your mouth, right? Like
Yep.
it can actually be a sign of other things going on in your body.
That's right.
Like what?
Yeah, so we call those systemic conditions.
Fun.
And that could be anything from diabetes to respiratory infections, even gastrointestinal issues.
Wow.
These things can create an environment internally that can actually manifest as bad breath. It's pretty amazing.
It's kind of like your body's sending you a signal, I guess,
Yeah, it's a good way to put it.
through your breath. Wow. So, okay, but how does it actually work, like scientifically? What's going on in there that's making the smell?
So at the heart of it all is, you guessed it, bacteria.
Bacteria, yeah.
Those tiny little microorganisms that live in our mouths.
So are we talking like the good bacteria, the kind that helps us digest our food, or?
Yeah, well, there's a whole community of bacteria in our mouth, right? Some good, some not so good.
Okay.
And some of those bacteria are responsible for breaking down food particles.
Huh?
And in the process, they release these volatile sulfur compounds. We call them VSCs.
The SEs, oh yes.
And that's what causes that odor.
So, I mean, I guess all bacteria, when they break stuff down, they produce some kind of odor, right?
Mm.
What makes the VSCs so bad?
Well, it really depends on the type of bacteria and what they're breaking down. But VSCs, they're particularly pungent.
Okay.
And they really have a way of, lingering. So that's why they're kind of the main offenders when it comes to bad breath.
So it's not just the amount of bacteria, but the type of bacteria and then the compounds that they produce.
That's right.
It's like a whole little ecosystem.
Exactly.
And where are these VSCs hanging out?
Well, you can find them all over the place, actually. On your tongue, especially the back of your tongue.
Okay.
Between your teeth. And in those little pockets around your gums, if you have gum disease.
Right, right. So, okay, we've identified the enemy, certain types of bacteria making these VSCs. So how do we fight back? I mean, good oral hygiene, I'm assuming?
Yeah, that's absolutely the first line of defense.
Okay.
Brushing twice a day, flossing daily, and cleaning your tongue are all essential.
Right.
Because you got to disrupt those bacterial communities.
Uh-huh.
But there's a catch. Even with, perfect oral hygiene, some people are still going to be more prone to bad breath. And that's where things like diet and hydration come in.
Hmm. I've heard that some people are just like genetically predisposed to having bad breath. Is that a real thing?
There's definitely some evidence that genetics can play a role in how your oral microbiome is composed,
Okay.
which could make you more susceptible to bad breath.
Gotcha.
But, it's still an area of research.
Yeah, yeah.
And it's part of the reason why there's not just like one solution for everyone.
Yeah, that makes sense. Okay, so genetics might be a factor.
Yeah.
But you mentioned diet and hydration, so tell me more about that.
Well, think about it. What you eat, directly impacts the environment in your mouth,
Yeah, yeah.
right? So certain foods, like, I hate to say it, garlic and onions.
Cool, the classics.
Yeah. They contain sulfur compounds
Right.
that get absorbed into your bloodstream, and
Uh-huh.
then they're released through your breath.
So even if you brush your teeth after, like, a garlicky meal, it's still in your system?
Yeah, it can be.
Oh, wow. Okay.
But on the other hand, those crunchy fruits and veggies,
Yeah.
they're like nature's toothbrush, like apples and celery. They help scrub away food particles and stimulate saliva production.
Yeah, I've heard that. Yeah, saliva's good, right?
Saliva's key. It's your mouth's natural cleanser.
Okay.
It washes away food debris, bacteria, and it even has enzymes that break down odor-causing compounds.
So you got to stay hydrated.
You got to. And speaking of things that dry out your mouth, alcohol and smoking,
Ugh.
those are no-nos.
Yeah, smoking's bad for everything, isn't it?
Pretty much, yeah. And alcohol, it just, dries your mouth out, which creates the perfect breeding ground for that bacteria.
Makes sense. Okay, so good oral hygiene, good
Thanks.
diet, smart lifestyle choices. That's a good foundation. But there's more to it, isn't there?
You're right. Sometimes it's a bit of a mystery. You got to do a little detective work.
Oh my God.
Sometimes you need professional help and maybe look into some other remedies.
Okay, this is getting good. Let's dig into that.
Let's do it.
Okay, so we're back and ready to get into some solutions for bad breath. We were just talking about needing professional help sometimes.
Yeah, definitely. I mean, sometimes you got to call on the experts, right?
Right, right.
Yeah.
But before we get into that, what about some of those other remedies, like the medical and natural kind?
Oh, yeah, yeah. Well, if you're looking for like a quick fix,
Yeah.
over-the-counter stuff like antibacterial mouthwashes, those can help, at least temporarily.
Yeah. They're good for freshening your breath, but they
Yeah.
don't really get to the root of the problem, do they?
No, you're right. It's more like putting a Band-Aid on it.
Right.
But there are other things you can try. Tongue scrapers, for example.
Tongue scrapers, those seem to be getting pretty popular. What's the deal with those?
Well, they're actually pretty effective. You see, your tongue, especially the back part of your tongue, it can harbor a lot of bacteria.
Oh, okay.
And those bacteria, they love to hang out there and produce those smelly VSCs. So using a tongue scraper, you can gently remove that buildup.
Makes sense. What about oil pulling?
Yeah.
I've heard people talk about that.
Oh yeah, oil pulling. That's an ancient practice
All right.
where you basically swish oil around in your mouth, usually coconut oil or sesame oil,
Okay.
for like 15, 20 minutes.
20 minutes, that's a long time.
Yeah, it is a while, but the idea is that the oil, it kind of attracts and traps the bacteria and pulls it away.
So it's like a magnet for bacteria.
Kinda, yeah. But the research on it is still a bit, limited.
Okay.
Some people swear by it, but it's not a magic bullet.
Okay. So maybe worth a try, but don't expect miracles.
Hmm.
So what about tea? I love a good cup of tea.
Mhm.
Can that help with bad breath?
Actually, yeah, some herbal teas can be really good for that.
Oh, okay.
Peppermint tea, for example, that's a classic.
Right.
It's refreshing, and it has compounds that can help neutralize odors.
Okay. Good to know. What about green tea?
Oh, green tea is great. It's loaded with antioxidants, and there's some evidence that it might even help reduce the production of those VSCs.
Really? So drinking green tea could actually help fight bad breath?
It could, yeah.
Interesting. What about other teas? Any other good ones?
Well, chamomile tea is another one that can be helpful.
Yeah.
It has anti-inflammatory properties, which can be good if you have, gum inflammation.
Yeah, which we know can lead to bad breath.
Exactly.
Wow, this is great. So many tea options.
Right.
But okay, what if you've tried all these things, the over-the-counter remedies,
Yeah.
the natural stuff, and nothing's working?
Yeah.
When do you know it's time to see a dentist?
That's a good question. I would say if you're doing all the right things at home, brushing, flossing, all that.
Right.
You're watching your diet, you're trying natural remedies, but you still have bad breath.
Yeah.
That's when you should definitely make an appointment.
Okay, so what are some red flags specifically? Like, when should you really, pick up the phone and call the dentist?
Well, if you notice your gums are bleeding or
Wow.
if they're swollen
Uh,
or if the bad breath is just really persistent, it doesn't go away no matter what you do.
Gotcha. Okay, so it's not just the bad breath itself, but also any changes in your oral health.
Mhm.
So what can you expect when you go to the dentist for bad breath?
Well, they'll probably start by asking you a bunch of questions
Okay.
about your oral hygiene routine, your diet, any medical conditions you might have. And then they'll do a thorough exam.
Okay.
They'll look at your teeth, your gums, your whole mouth.
And what if they find something like gum disease?
Well, then they'll recommend a treatment plan,
Okay.
which might involve a deep cleaning, to get rid of plaque and tartar buildup. Or, depending on how severe it is, they might need to do some more specialized treatments.
So even if it's gum disease, there are ways to treat it.
Hmm.
But what if the dentist says, hey, your mouth looks great, everything's fine,
Mm.
but you still have bad breath?
Well, in that case, it might be time to consider those systemic causes.
Right, right.
Those things we were talking about earlier. Your dentist might recommend you see your doctor just to rule out any underlying medical conditions.
Wow. It's amazing how connected our oral health is to our overall health, isn't it?
It really is. And there's no shame in asking for help.
Yeah.
Whether it's your dentist, your doctor, or even a specialist, it's all about working together to figure out what's going on and finding the best solution.
That brings us to the big question. Can halitosis be cured?
Well, that's a bit complicated.
Oh no, a cliffhanger.
Yeah,
I guess we'll have to find out in the final part of our deep dive.
you got it. We'll unravel that mystery and more in part 3.
Okay, so we're back, and it's time to find out if halitosis can actually be cured. We were left hanging.
Right. Yeah, well, it's a bit more complicated than a simple yes or no. Like we were saying before, it really depends on what's causing the problem in the first place.
Okay, that makes sense. So what if it's something, relatively straightforward, like bad oral hygiene or gum disease?
Well, in those cases, yeah, the outlook is usually pretty good.
Okay, that's good to hear.
Yeah, I mean, with good oral hygiene and, of course, professional treatment for gum disease if you need it,
Uh-huh.
you can often get rid of halitosis completely. It's like you're giving your mouth a fresh start.
Okay, so those folks just need to, establish good habits and stick with them. But what about those more complex cases? Like when it's caused by one of those systemic conditions we talked about.
Right. Well, in those situations, it's a little trickier.
Okay.
It's not so much about curing the bad breath itself, but more about managing the underlying condition.
Yeah.
So, like, if you have diabetes or a gastrointestinal issue, that's what you need to focus on treating.
Yeah.
And by doing that, you'll probably see a big improvement in the halitosis, too.
Okay, so it's all connected.
Exactly. It all comes back to that mind-body connection.
That makes me feel better.
Yeah.
It shows how important it is to, see a doctor if you have persistent bad breath.
Yeah, absolutely. They can figure out if something else is going on and help you get the right treatment.
Okay. Now, we also talked about temporary causes of bad breath. Certain foods, alcohol. So what about those? Can you cure those?
Well, with those, it's more about making smart choices.
Yeah.
Like if garlic makes your breath smell, maybe skip it before a big meeting or a date.
Right.
And cutting back on alcohol can help too. It's really about knowing your triggers and making adjustments.
Yeah, sometimes the simple things are the most effective. Now, what about those chronic conditions like dry mouth and tonsil stones? Can those be cured, or is it more about managing them?
Yeah, those might require ongoing management, but even then you can often reduce the bad breath significantly or even control it.
Okay.
So like with dry mouth, you might use saliva substitutes or talk to your doctor about any medications that might be causing it. And for tonsil stones, gargling regularly can help, or you might need to have them professionally removed.
Wow. This has been so interesting. We've really learned a lot about bad breath, haven't we? We've identified the culprits, explored different ways to prevent and treat it, and we've learned that fresh breath is possible no matter what's causing it.
Yeah, it's been great. And it's important to remember that fresh breath isn't just about, feeling confident. It's a sign of overall health and well-being.
You're absolutely right. And on that note, we'd like to leave you with something to think about. We've talked about all the bacteria in our mouths, the good and the bad. But what if we could actually, manipulate that bacterial ecosystem? Make it work for us?
That's a really interesting idea. As we learn more and more about the oral microbiome, I think we might be able to do just that. Develop more targeted, personalized approaches to oral health.
That's exciting. Imagine, customizing your oral hygiene routine based on your own unique bacteria. The possibilities are pretty amazing.
They really are. So keep learning, keep asking questions, and keep striving for that fresh breath confidence. Until next time.